charges. I thought I may still get well to board the flight, but my doctor said, don't do that. You're a diabetic. You can actually harm your liver and spleen and even creatinine levels with this level of fever and other symptoms that you're showing. So I said, okay, I'll go by your advice. So, yes.
Okay. So welcome everybody. We are now live on our LinkedIn channels and YouTube as well. It's a pleasure to have you all here, and it's just waiting up a few minutes so we fill in the room with some participants that are arriving, as well as from Zoom participants that will be with us. So it's always a challenge to do a hybrid meeting, but thanks to the support, fantastic support of GD Hub team with whom we are collaborating, we managed to be here in a hybrid setup directly from the campus Biotech, and with our participants online joining us for the opening session of day one, Europe-India Digital Health Week. And we're kickstarting this series of events with today's event. It's going to be a hybrid session with an opening session and then a knowledge cafe here in the room. Finally, at 12 o'clock Central Europe time, we're going to wrap up the session with the conclusions again here live with all of you, dear viewers, followers, and participants. A warm welcome also to everybody already in the room. Thank you so much for joining. Please take your seats here at the front. It's going to be a small group with 20 participants on the room, 20 participants online, and I'm sure plenty of followers on our LinkedIn live feed right now. And it's really great to have this moment together to talk Kickstarter Europe-India Digital Health Week, a space of dialogue between two leading regions in the world, two leaders in global health that are going to start a conversation that we expect to be fruitful and bringing benefits to all our citizens that are hoping for better health, better services. That's what we have here in the program. With me online, we have Professor Rajendra Gupta, Kickstarter of this initiative. We are going to start today, data first, AI later, the movement we hope to start today, as well as George Matthew. George, good to see you from the US. George is Chief Medical Officer of Dedalus, but also in this capacity as our advisory board member, person that was from the start inspired this dialogue to happen for the reasons I've just explained, as Europe and India are two regions that can lead a conversation in global health. Thank you all Zoom participants for joining. It's great that you are taking time to be here with us and also in the room. I think that we might be able to wait a few more minutes as I do a presentation of our speaker in this morning, along with Professor Rajendra Gupta. Dr. Steve McFeely is here with us, statistician, and since last 2 years, Steve, director of health, 3 years as a director, time passes by, of health data and analytics at the WHO, and long time participant and guest speaker in the Health Data Forum events that we had in the past, and joining us here today. So perhaps without further ado, I'll ask Steve to join me here at the table. I will put my screen here for And maybe we can kickstart the session, if I may, with the presence in the room. I think some participants will be joining first, but we have a good Zoom presence, and our live stream viewers are eager to hear from us. So without further ado, I'm going to pass the floor to our two guest speakers and co-chairs in this summit, as well as Caroline Perrin. She's going to join us also in a minute, and perhaps at the end of the opening session, she can also share some words with us. So maybe, Steve, you can kickstart the session, and then Rajendra, you will follow from this. And we have until 10 a.m. local time to conclude this session here. If we have time within this hour, we can also open the floor for open comments if you like, and if you are open to questions from the audience. So over to you.
So I should speak this way. So good morning, everybody, ladies and gentlemen. It's a great pleasure to be here. Unsurprisingly, I'm going to talk about data this morning. So ladies and gentlemen, it's my contention that data, perhaps after the climate crisis, is the biggest issue facing humankind today. And I should note that data and the climate crisis are not unconnected either. On the contrary, data are now a major contributor to our climate crisis, and I'll come back to this point in a minute. But let me start by saying that data, I would argue, is the single word that defines our age. Today, data have assumed a new importance for economies and societies. They're at the heart of almost everything that we do. They're a ubiquitous, globalized commodity, easily shared, easily duplicated, easily traded. They're the glue that binds everything that we do: the digital economy, communications, government, social media, the cloud, blockchain, the Internet of Things, cryptocurrencies, even politics. But because of that, data offer huge promise, but also huge peril. They can be a tool for liberation, but also a tool for exploitation. So until recently, I think it's fair to say the data revolution has been a silent one. Or should I say the digital data revolution has been a silent one. It slipped quietly into our world, into our consciousness, on the slipstream of the digital and ICT revolutions. And for so long, we've simply thought of data as an input, a byte that we feed into a computer, something that we aggregated, a tool to inform decision-making. But I think that time has passed. Data are now a policy issue in and of themselves. And given the importance of data to the globalized digital economy, to surveillance, to politics, to artificial intelligence, to health, there can be few more important geopolitical issues in the coming years. Some argue that data is a new form of capital. Others are now arguing, in fact, that data is a living organism with which we have a symbiotic relationship. It may well be both, but what's beyond debate is the central nature of data in our modern lives. And without question, it's already one of the most critical pieces of infrastructure in modern economies and modern society. And I use the word infrastructure advisedly, because data require production, transportation, security, storage, refinement, dissemination. So the architectural design of such an important piece of infrastructure should not be left to chance. If we want to move beyond the hyperbole and really achieve the potential of digital health, then we need to take data seriously. Most certainly, if we're serious about AI governance, whatever that might mean, then we need to take data governance seriously, as one is a prerequisite of the other. And until a recent awakening prompted by generative AI, most of us have not been paying attention to data governance at all. The last time humankind faced a new technology or a force of this magnitude was arguably the discovery and the harnessing of atomic energy in the mid-1940s and the subsequent decade. But unlike digital data, the discovery did not slip quietly into our consciousness, but it was imprinted graphically by the dramatic and horrific conclusions of the Second World War. An unanticipated benefit of that shocking coda was that it convinced both scientists and politicians that atomic energy could not be left ungoverned, and some sort of international standards and cooperation framework would be required to avoid global disaster. Thus, from the ashes of Hiroshima and Nagasaki rose the International Atomic Agency. Today, we are grappling with an energy, a technology every bit as powerful and potentially as dangerous as atomic energy. And that energy or technology is digital data. As I said, it's announced itself quietly, the silent byproduct of the technological and information revolutions. It surfed in on the libertarian ideals of a free and untrammeled internet. Digital data was viewed as innocent, a universal public good. But as time passes, we're slowly awakened to the fact that there may be a serpent in the Garden of Eden. So what are the challenges that are facing us now with digital data? A fragmented dataverse already exists, comprised of several different data ecosystems and built around three ideologies, or what's known as the three dragons: the primacy of the state in the East, the human rights or the individual in Europe, and free enterprise in the United States. And the big question facing us now is whether this genie can be put back in the bottle. Can different regions be helped to understand that cooperation is in their best interests? When will governments wake up to the fact that they live in a data era, that they need to take these issues seriously, and that data are not free? In fact, the price of data and not taking data seriously may be prohibitively expensive in the future. We must help governments to overcome their naivety and face up to difficult questions, not least in a world where data are a globalized commodity. Is the idea of national data sovereignty a fantasy? Are governments just sticking their fingers in the dam? As I mentioned earlier, data too have a serious environmental impact. For example, it is now estimated that based on current growth trends, sometime around 2040, the world's computer chips will demand more electricity than is expected to be produced globally. And so perhaps in an unexpected turn of events, climate change and data governance are joined at the hip. So what's going to trigger change? Perhaps it'll be artificial intelligence. In recent years, the awakening to the potential of generative AI has provoked serious political action. We see countries debating a global digital compact at the UN at the moment, and a large part of this deals with AI governance. But how on earth is AI governance possible without data governance? In short, it's not. Data governance is a prerequisite to AI governance. And this is the logic of data first, AI later. There's a sequential order that must be respected unless we are to waste billions of dollars and squander the trust of millions, if not billions of people. If we do not put in place some sort of data governance framework or mechanism, tears will surely follow. So what has this got to do with health? Well, if we want to realize the lofty aspirations of digital health, of patient first, then we need to be able to share data, we need to be able to link data, and this implies putting in place facilitating data infrastructure. And that, ladies and gentlemen, ultimately brings us back to data governance. To do all of this safely, we need robust data management and data governance systems. Thank you.
Thank you so much, Steve, for these opening words. So well prepared, but so deep in meaning. Over to you now, Rajendra. If you'd be so kind also to share some thoughts for the opening session.
Thank you, Dr. Paul, and thank you, Steve, for setting the context very well. I firstly congratulate you, Paul, for the wonderful work you do through Health Data Forum, for bringing spotlight on the issues through the Europe India Digital Health Week. I think, as you said rightly, the coming of the East and West is getting the house in order, and you are doing it brilliantly. I know it doesn't happen so easily, so I thank you, your team Sophia, my team Dr. Manpreet, who have been with you in this journey to get this where it is today. I wish I could have joined in person, but for some health issues I couldn't come in person. But To me, first thing I would say is let's get it clear that data is not oil. Data is about health. Let's not confuse what data means. I would also go to the extent of saying that for health, data is identity, data is diagnosis, data is treatment, data is a health coach, and data is medicine. And this is not a statement. It's actually in practice being used. And countries, are there with policies in place that reimburse products based on data, which patients use as medicines even. So for me, data is much beyond those four alphabets and a word. And the challenge I always see are multifold, some of which Steve has addressed, so I'm not going to talk about them. But let's also understand while data is important, data will drive medical science going forward. It's not going to be the other way around, so we have to be extremely careful about it. But at the same time, let's not forget that 2.6 billion out of 8 billion people do not have access to internet. So obviously, we will have a bigger digital divide than the physical divide. So we are going to exacerbate the health divide that's there. So I would say when we look at addressing the issues with data, equity has also to be taking center stage. I think we always look at patients first. If there is going to be patients first and not profits first, then it's going to be data first, not AI first. And that's the genesis of what we are trying to do as launching this large campaign of democratizing what we need to do. Data has become a technical issue. We'll discuss, I think I call the 3 I's of data: integrity, integration, and intelligence. Unfortunately, we have prioritized intelligence before integrity and integration. So that's where I think our bigger challenges will arise. One of the things that's happening as we talk today is the pandemic treaty that's going to happen. A lot of things is about data. Data about viruses, the causative agents. But what I feel, I think, is a forum for us to highlight any polar public forum we should take care of the global context is that when the global north will ask for free data, the global south will ask for free products. And that's also an issue of equity for me. Let's not clear that out. I think those who have read the pandemic treaty context, their documents, we will get this clear. I think those things also in the context of data we have to address. Digital footprint will have carbon footprint, we'll have to address that going forward. And I think I'm still back to the same big goal that we will launch in the later part of this day is if we do not address data first, we keep prioritizing AI, we will have more side effects and wrong effects of AI than we can ever contemplate. So I'll stop here, Paul, but a very important forum to put important points across. And I'm so fortunate that I have an opportunity, thanks to you and the Health Data Forum and the Geneva Digital Health Hub, to put my points across. The rest as we proceed. Thank you.
Thank you. Thank you so much. Thank you so much for these opening words. And it's really a pleasure to have also here with us participants that I'm sure would also like to address or ask some comments on this intervention, as we are pleased to have here in the room some participants. And as well, George, maybe starting with the online participants, you would like to comment on these words as they were quite inspiring, I would say.
Exactly, Paul, and thank you, by the way. When I listen to both Stephen and Rajendra as they describe the need, I think one of the things we have to consider is explicitly defining the benefits of sharing data. Because as we talk about how each region handles their data and their health, even though they've taken slightly different approaches, in the end, the common goal is to improve the health of our citizens, of our people. And I think one of the things that we've seen that's worked across the decades really has been an exchange of ideas, but also taking the right approach to respect everyone's core beliefs and processes and governance is vital showing respect to both sides as to how they approach it. I was trying to do a comparison a bit before the meeting. My apologies, I didn't get to finish it. As the EU starts looking at things like the European Health Data Space as a way to pull their data in, when we look at India, India has also made some strides, in terms of their national digital health mission commitment, in trying to bridge the gap. Obviously, there are gaps on both sides, but perhaps that might be a way we can start to identify the similarities between us, identify common goals that we're trying to attain, and take it in the spirit of trying to help each other. There's no one side that's mastered this or figured it out. And being able to share the perspectives from the other side and seeing what works in certain circumstances may allow for that bridge to be built. That's pretty much it, Paul.
Thank you. Thank you so much. There was some interesting comments. I would like now to invite participants in the room. Maybe you could share some comments also here. We have participants that are health leaders, like in front of me I have Ricard Batista-Leit, is the CEO of Health AI, a recently created agency that also addresses these topics. Maybe Ricardo, you like to comment and share something for the room? We have until 10, if you like. It's okay. I think if you speak from there, everybody will listen to you. Or
can people hear me online? Yeah. Okay. You just can't see me, so.
no, I will. They will see you. They will see you.
Well, thank you very much, and good morning.
They will see you now.
15 colleagues here in the room, and to everyone online, and particular gratitude to Paul and also Professor Gupta, with whom I was just not too long ago in New Delhi. And just a few words to say, and without being able to stay until the end of the session, we have a UNESCO session on artificial intelligence happening not far from here, crazily for all of us. I really wanted to come for several reasons. First of all, out of respect and friendship with the two co-chairs of this session. Secondly, out of the acknowledgement of the need, I would say, for us to build up on the relationship between the European Union and India. And I think that there are people online and in the room that can help make this happen. And thirdly, because I am absolutely convinced as we transition from the fourth industrial age towards an age of intelligence, there is a need for us to address many of the challenges. I won't go into the data challenge that has been extensively mentioned. As Paulo said, I am responsible currently as CEO of Health AI, the global agency for responsible artificial intelligence in health, a nonprofit foundation based here in Geneva, and working with WHO and governments towards building a global regulatory ecosystem for validating AI solutions in health. But I'm also, as a former parliamentarian from Portugal, the founder and president of the Unite Parliamentarians Network for Global Health, which is a network of current and former legislators from 112 countries committed to science-based, data-driven policymaking. You would think that saying that we should use science to do policy would be a given, but it's becoming a challenge to convince people of how that is important. But that being said, we are seeing artificial intelligence as the greatest opportunity of humanity to help us rethink health systems. Health systems are broken. They are focused on disease. They're completely reactive to disease. And this is leading to a rise of the burden of disease. And at the same time is leading to an unsustainable rise of costs. We need to rethink the model, top to bottom. And that means we should embrace this transformative technology as an opportunity to do. The thing is, most of the solutions we are seeing out there are solutions that are trying to retrofit the technology into the current analog model. And that is where innovators like us have a tremendous opportunity to be able to help us as a community rethink from scratch how to develop a new vision for healthcare, especially as we are pushing for universal health coverage. Which what we are seeing today, and something that personally concerns me tremendously, is that we are exporting this broken, disease-driven, unsustainable health model into low and middle income countries. We're seeing huge hospitals being built in regions of the world where there's no healthcare workers. And so it's a lost opportunity to invest in a transition that could lead to leapfrogging to an era where instead of focusing on disease, we can actually focus on well-being and quality. The other issue that I wanted to raise is at Health AI. When I took on this role last year, we conducted a survey to design our new strategy. And it was a survey to legislators, governments, regulators, but also patient organizations, academic partners, technology developers. The most common word we heard related to artificial intelligence and health was the word fear. Fear related to the lack of understanding of the technology, fear related to not knowing how to regulate and address the technology, fear of its potential harmful impact, especially with the hype in the media that we see every day. And so we understood that there was a concrete need that needed to be addressed, which is fixing the governance of artificial intelligence. And doing so for two reasons. First of all, we want to make sure that citizens and systems are kept safe. But secondly, to make sure that there is a real adoption of the technology, which demands trust. Without governance, there is no trust. And without trust, there is no adoption. And without adoption, we do not make the most of the innovations that have transformative impact and the health outcomes that we need. And so if we're able to fix the governance issue early on, even before the international standards are out, we stand a chance as a global community and ecosystem to actually develop a vision where artificial intelligence can be accelerated in a way that ensures its safety, quality, and effectiveness. And so we decided to address that issue as a nonprofit. And so if you imagine Health AI as a bridge, on one side of the bridge, you have the normative standard setting organizations like the WHO that are responsible for defining standards. We do not do standards. And on the right side of the bridge, you have the regulators, the ones that actually are in the countries validating AI solutions. We do not validate tools. What we do is we support countries in interpreting and adapting those international standards and supporting the building of capacity to validate AI solutions by creating a global regulatory network of regulatory entities. And through this, our main goal, or one of our main goals, is also to ensure that we create a global early warning system. So if there's an AI tool from Indonesia to Brazil to Switzerland that has the potential to cause harm, we want to make sure that every regulator in the world gets a red flag so safety brakes can be put in place. And between regulators and technology companies, we can work together to solve those technological challenges. We're also working with the Digital and Innovation Department of WHO to build a repository of AI solutions. So as regulators validate tools, those tools that are validated will appear on a global open source platform. So everybody can see what tools are out there that have been validated by regulators around the world, which we consider to be extremely useful. At the end of the day, we need to nudge the world, health systems, regulators, technology companies, all in the direction of understanding that to make the most of the potential of artificial intelligence, we need to do so responsibly, ethically, inclusively, equitably. And this is something that can only be done if it is done with purpose from the start. So to end, I just say there is a book called Power in Progress that looks at the evolution of technology over the last 1,000 years. The conclusion of the book is very simple. It's such a big book that I'll tell you so you don't have to read it. If the technology, so over these 1,000 years, technology companies have always come out, the technologists have come out saying, our technology is going to save the world and save humanity. In most cases, that did not happen. The few cases when it did happen over the last millennium were the cases where by design, the equity and inclusivity were embedded from the start. where we are in terms of the mass commercialization of AI. We are still at that beginning. As humanity, we stand a chance to learn from mistakes of the past and make the most of the technology moving forward. And I have no doubt that the two powerhouses that are represented here today in Europe and India can play a transformational role. If we join forces, nothing really can stop us. So thank you so much for having me here.
Thank you. Thank you. Thank you. Thank you so much. Maybe co-chairs, you like to comment these? Steve, Rajendra?
Well, from what I've heard so far, I mean, I think that the point that Raj made around equity is absolutely critical. I mean, that's really what all of this is about. We have to overcome digital divides, we have to overcome data divides and make sure that everything that we're doing supports equity. And this ultimately is what will help us to achieve universal health coverage, which really is about equity of access to healthcare. And I think just on the last point, the whole issue of progress of technology, I mean, it's not something to be feared, it's just something to be managed. You know, we can't avoid risks, we have to manage them, but we need rules. And I think there's a good analogy. I mean, if you think about cars, I mean, the fact that cars have brakes, the fact that we have rules of the road, that actually allows us to drive faster, not slower. Like without that, we wouldn't be able to drive fast at all. We wouldn't get anywhere. So it's putting in place basic systems and governance rules that allow us to achieve all of the things that we want to achieve.
Thanks, Steve.
Rajendra?
Yep, yeah. I mean, listening to Ricardo, and he's always brilliant in how he articulates his point. So he actually provokes the right kind of thinking, which is important. Ricardo, thanks for that. And thanks, Steve, for adding to that. My always worry has been, you know, that I had a career spanning private sector and then being a part of the government, writing policies, being a part of multilateral bodies, which I still do. The challenge is who sets the narrative? And the world gets driven by narrative today. So that was the reason of me and Steve and Paul discussing that it's time for us to prioritize data before AI, because everyone is talking AI, not talking data. But having said that, there is also two fights that will keep going on. The fight between the greed of big tech and the need of LMICs. I think LMICs are not going to get a room to talk about. They will always be on the footnotes and cover pages, and, you know, glossy reports will be released. We'll get very happy about it. They will be our part of the forums. We will have 1 or 2 speaking slots. But has the world changed? I'll give you an example. And Paul, this is very interesting to note. I also lead the Dynamic Coalition on Digital Health at Internet Governance Forum, besides leading Internet and Jobs and Environment at IGF, which is the body of the UN. So what we did, I mean, this sets the context and the path forward for us very clear. And since we have the right people in the room, it doesn't matter whether there are 10 people in the room and 11 people online, but I think what is represented is the entire stakeholder community. Ricardo represents entire parliamentarians, plus he represents many stakeholders along with Path, I see other colleagues, and Steve from WHO. So last year, IGF formed a high-level panel for AI, and the Japanese Prime Minister was in the room. I had top people from all big tech, which are always present, and I guess 170 countries. It's a UN body. And my question to the team was, you have set a high-level panel for AI and no high-level panel for connecting 2.6 billion. What kind of priorities are we talking about? So let's not make big forums the narrative setting agenda for the business. So if you prioritize profits, then you will talk of AI. If you prioritize patients and people, you will talk about data first. So I think, Paul, wonderful initiative from your Health Data Forum to get this, and GD Hub to support this, and other people who joined us today taking out their time. I know what it means to be a part of the World Health Assembly and still taking out time for this meeting. I would say that people like Ricardo have phenomenal clout. We should use those great souls to put that, what kind of narrative are we setting? See, regulation is very late in the day for me. I mean, when writing policies 1.4 billion, I don't care about narratives and those big corporations and their profits. I have at my call a responsibility for 1.4 billion that can decide how the rest of the world will look at us. What data? Is there a structure of data today that we can talk about that is to be shared? Are the world, I mean, look at the fine print of the pandemic treaty, and I should tell, I mean, this is a moment of truth for us. Most of the negotiations are happening within the WHO, not even outside. And no one will talk about pandemic treaty in this room today, but that's all about data. So I'll share the data of pathogens. The West and the big tech will use it. Global North, as I said, is greedy about data. So they will talk about democratization. Actually, they're talking about monetization, but they're using the word democratization. And that's my big challenge. And what I want is the real democratization, which is decentralization. So let's also be very clear about the words and the connotations of what come with data. So regulations is very late. First, source of data, how do you get it, who use it, for whom? Look at the fine print. 10% subsidies, 20% subsidies to LMICs, 80% will go to product development. Is that what we want to do as pandemic treaty? I think it should never get through. Are the people in the room? I have been a part of various policy formulations. I mean, you will see, I will not name countries of the West. They will put their foot down saying, we will not sign it. I think we got to go by one country, one vote on important issues with data, not $1, one vote. Can we change those systems? So for me, equity means all those things. Equity doesn't mean photographs, and footnotes and glossy reports featuring some parts of LMICs. I think there's a bigger context here. The greed of global North and the need of global South. That for me is equity. 2.6 billion people. Will they know what is data? Do they really know what data is being shared? Don't make it, I don't want to, but let me get blunt on this. Cocoa comes from which country? Go and look at the state of their country and look at the countries that sell chocolates. Go to Switzerland. You want to make another Switzerland out of data? Let's not do that. I think I would make this point here is that if I see another Switzerland, we would all be the culprits because we are the ones, Ricardo, people like me, people like Paul, people like George, people like Path, all of us sitting in this room have an onerous responsibility of not looking at, we have no personal interest. None of us run companies which work on data. I don't. I run Health Parliament that operates in 15 countries. For us, the word parliament is sacrosanct in terms of representing people whom we should represent, the stakeholders. Let's not make another Switzerland of cocoa, which is data. And the poor Africa remains mining cocoa and sending it to the world for chocolates. So let's get that things right. And data should mean real equity, real inclusion, and real outcomes. Without outcomes, equity means nothing to me. Yeah, so I would stop here. There's a lot to talk. We are all very passionate about it. Sorry, Paul, about that. But we hope that we should not become narrative setting agenda for the big tech, which always happens at the end of the, I mean, no one's fault. I mean, but at the end of the day, all the things you do, you need money and they will just throw money where they want to put their narrative. So let's see what we can do to avoid the temptation.
Okay, thank you. Thank you so much. I think equity and inclusivity are in the plate right now for the conversation to proceed. And in terms of equity and inclusivity, and having next to me the WHO director of health data analytics, Steve, what could be the lessons you can extract from your work when trying to get health data governance established country by country in terms of equity and inclusivity? Is this a priority for the countries that are trying to address the challenge of health data governance?
Yeah, that's a tricky question. It's not always a priority for countries, and that's unfortunate. And it's unfortunate for two reasons. One is, in some respects, data governance and health data governance is being forced upon countries by the European Union because they're moving ahead very quickly. And countries aren't necessarily being given the policy space to consider this. And maybe up until now haven't wanted to consider it. It just hasn't been on their radar. So it's very important that the European Union model isn't foisted upon the rest of the world. I mean, it works for the European Union, but it's not clear that it's appropriate for anywhere else. So it's very important that countries and regions can develop their own policies around how they manage their own data. And it's very, I mean, there was a very interesting side event last night, you were at it, Paul, and in fact, the issue of data colonization came up. And this is one of the fears, I think, for all of us, is that just as Rajendra was mentioning, that data are harvested all around the world, but then flow back to either a number of companies or to a number of countries. And that's really what we want to avoid. We want to really promote data localization, where the data that are harvested are used for policy decisions in those areas. And so that it informs policies, informs decisions where those data are appropriate. But it's really important that governments understand this and take a stand on this. But equally, it's very important that they're given the time to do them, because in a lot of cases, I think governments have maybe been caught a bit unprepared and haven't given this the time and attention it deserves. And now they're being kind of forced very quickly to make decisions and haven't had, as I said, the policy space to think about it. And I think that's really important.
Absolutely. Thank you so much, Steve. George.
Thank you, Paul. You know, it's hard not to think about everything that everyone has said so far, but I also want to put it in context as to why it's important that we're doing this now. You know, Rajendra brought up the idea of the global north and, you know, used cacao as an example of how that system was kind of built up by, you know, like any business, getting inputs at a very cheap price, putting the priority at the processing of those ingredients, and then selling them at a premium and keeping the margin in between. There were some earlier comments that described data the same way, where raw data is seen as almost free, and it should be free, at least according to the processors, and the value is being put in the middle part where the data is being processed, which is why it's sold, not just data, but artificial intelligence is sold as a premium. That sounds great if you're an existing business. But when you look at the actual outcome of what's going on, especially with the acceleration with generative AI, what we're seeing is that they're running out of good data. You know, it's an interesting concept where they've digested as much data as possible. And because the models are recursive, because of the fact they've had to use and recycle data multiple times, we're seeing with Google now that they're getting very, very bad results out to people with no consequence. And what we believe will start to happen is people will start getting higher quality curated data sets, but they'll start putting up walls around it to protect those data sets to keep their competitive advantage. So as that starts to proceed in the market, establishing governance and rules that respect equity, that respect the laws that are set up within different countries is crucially important, especially when it comes to health, because health data, at least where we are now in the States, has a higher premium, at least in terms of its value, but from the user's perspective, it does them no good. This data is taken about them and used around them to monetize it, but it gives them no direct benefit. Even access for a lot of folks is difficult to get their own health data and use it in a way that would actually improve their health. So as we discuss how that data has to be governed and managed, we really need to start thinking about a more inclusive model, one that actually gives more agency to the data subject as to how their data is going to be used, more transparency as to how these large tech companies or other entities might use that data, whether it's provenance or whatnot, but also the ability to direct and choose who gets access to their data. We can talk about whether there's a monetary value to it, to the data subject. Obviously, there are pros and cons to that, but the idea of giving people a choice, you know, again, I'll use the US as an example. People are aware that their data has value, health data and otherwise. And when they're not involved with the decision, they can sabotage any effort to use that data in a way that might be productive. When we were suffering through the pandemic and some of the federal and state governments were trying to create our own version of contact tracing, people started turning off their phones, or they stopped reporting when they were doing testing, precisely because they realized that without any choice, they were being tracked and their data was being used. So rather than contribute to the system and allow for tracking of the pandemic, they just chose not to participate. So we can't underestimate the value of actions taken from the data, which is what it's supposed to do in the first place, inspire us to take action. If we don't create a true governance model that's rooted in equity, people will respond by not participating, and that will stymie any efforts we have to try to improve health. But there has to be that transparency and that consent given to folks, which luckily, when we talk about the EU, when we talk about India, that exists. So that is some of the common ground we can use to start talking about how data could be governed between both parties.
Thank you. Thank you so much, George. I also would like to acknowledge some participants we have here in the room. Samir Kanwar is here with us, and digital director of digital health and for India and South Asia of PATH. Welcome, Samir. Would you like to also comment on what you have just listened so far? It's for our viewers, and if you take, taking the.
Thank you, Paul. So I think at the outset, I would like to congratulate the organizers. I think because AI is the new fashion buzz around the tech industry, right? So if you're not talking about AI as an innovator or a tech person, then probably you are way behind in life. That's what the thought is around, right? So I think bringing the larger agenda of data into the room is extremely, extremely important. And because I think to the industry, it does not fetch much of money and business, so therefore, it is left for the governments to sort this out. I would resonate quite a bit with what Ricardo said and what Dr. Rajendra said, right? In terms of we have larger problems in the room to solve before we look at technology, being able to give us equity and universal health coverage, which we are focusing on, right? Now, in terms of what Dr. Rajendra mentioned, that 1/3 of the population in the world does not have internet connectivity, right? Now, similar numbers are there in terms of having ID systems, right? A unique ID to this to the population, right? And I'm not talking about digital IDs, by the way. So 1/3 of the world does not still have IDs in place, and the number who don't have a digital ID in place is much higher. And therefore, till the time we solve those problems along with the connectivity and the infrastructure issues, I don't think we'll ever be looking at equity or universal health coverage, right? That's one. Second is, what Ricardo mentioned in terms of we are trying to retrofit technology, which is very true, right? In terms, because our systems were designed as data entry systems. They were never designed with a human-centered design in place, right? When they were designed probably a couple of years back, right? And therefore, there is no ownership of those systems, right? And I think it was one study of INSEAD which said that 95% of the health data does not get used for decision making. Obviously, there's a quality issue to it. There's a huge issue of quality to that data, largely because it is not used. So till the time you start using this data, it comes into a normal system of usage as part of the health system. The quality is never going to improve, right? Because we are not even seeing that data, unfortunately. And a point connected to it is that when we look at system design, then I can give you an example here, right? For example, let's say if I have HIV cases, we know that they are prone to TB. Now, unfortunately, we would have two different systems, one looking at HIV and the second looking at TB and not talking to each other. So I still can't in countries be able to find out a person who has HIV and probably is moving towards TB or is already TB positive. So we are doing those treatments, unfortunately, with specialized doctors in different spaces. Now, coming on to my last point, in terms of, when we look at technology, then the technology industry, it is business driven, it's in the private sector. Whereas we need to solve problems of public health, right? And therefore, there is a gap, and we don't have the right partners who are, able to bridge this gap out, right? So the governments are looking at technologies, but really don't know how to reach out to those tech people, right? And secondly, technology is getting developed, right? However, they are looking at data. Data is being owned by the government, right? And the government has a trust deficit when it comes to engaging with the private sector for public health. And second is also what Dr. Rajendra mentioned in terms of the gap between countries and then the geopolitics around it, right? So therefore, those are challenges which need to be addressed by partners and then players like us, right, in the room. RB as WHO and then PATH and other entities, are able to address and bridge this gap and make governments understand that they own the data. We need to share that data. Are we looking at anonymization frameworks to come up so that, we remove that trust deficit? We are talking about regulations at one end, but we also need to look at the technology aspect of it to be able to make data available, which can be used, right? And that fear which Ricardo talked about in terms of data is not there in that room. And one of the initiatives which we looked at was, with respect to AI has been to look at how do we look at impact to these technology or emerging technologies on public health, right? Because the use case of and the scale is in the public health, right? And we also need to bridge that gap when the private sector comes and starts supporting the public sector, they do not find the business models around it, right? So where are those business models for them to be able to support the public sector? And the other end, the public sector needs to define their use cases, right? So we are building this technology without even understanding what is the requirement of service delivery in public health. Are we solving real-time problems for public health or not? For example, let's say a WHO report says there are 9 million doctors who are going to be deficit by 2035. Is AI going to be able to solve that problem for me? All right. So are we identifying those problem statements in public health, which then can be given to the private sector innovators to be able to solve those problems of public health? Well, unless until we do that, there is no business model around it, right? There is no scale around it. And we keep doing these pilots over a donkey years, right? We've been doing it. We've left digital health at some point in time and hopped on to the next bus, of AI, without even realizing that we don't even have basic systems in place to be able to use AI to go forward, right? So I think we have some very basic problems, and one of which you've already highlighted is data, right? And unless until we solve these very basic problems, hopping onto the bus on AI and trying to solve real-time problems is probably far off. Thank you.
Fantastic. Thank you so much. We are approaching the end of our opening session, but still, I would like to have some views and comments here in the room. I have with us Mariana Canela Paz. She's the Data Science Director of MTG, our sponsors for this event and this Digital Health Week. Mariana is someone who is working hands on the field. Maybe can you share some comments on what you have just listened here about these challenges? Maybe you can come closer. Yeah, move closer. Yes.
Thank you very much for the opportunity of hearing all your perspectives. And maybe what I would like to say is that, at least from my view, AI, it's probably a commonplace to say this, but data and AI suffer from challenges that stem from its own potentials, which is it's an inherently multidisciplinary field. So it's hard to see it from source to the outcome it really wants to achieve. And probably all these perspectives, the fact that it has cultural impact, all the international perspectives are using, and maybe this is even an opportunity for us to reevaluate other stuff other than data and AI. But I think it's these multidisciplinary aspects of it that makes it so difficult to put it to use when it has so much potential. And I feel that all these aspects that have been referred, I hope that we can get away for all these different professionals that contribute to AI to be able to not have everything lost in translation between the different professionals, I come from a clinical background. Now I deal with more with data, and I feel that we really need to bridge these fields so that it works, be it more the political side, the regulatory side, and also the clinical. I would also like to say something on the data quality, because of course, without it, we cannot do anything. But data quality begins in the care, providing the care. And sometimes we are looking already to the data that is in the tables, so that I can give some more. But I think we need to go further back and to where it is generated, because data quality means that it contains information that really reflects the true state of the things. And for us to guarantee this, we need to have the full spectrum from healthcare itself to the outcomes that we want to achieve with these things.
Fantastic. Thank you so much, Mariana. I would also like to hear from our supporting member, Lisbeth Siderius here, and final comments by Sophie Deleg, also from Digital GD Up. She's probably put on the spot, but she now has time to prepare some words, as I'm sure she'll be able to contribute significantly. Lisbeth.
Thank you for organizing the meeting. I think India and Europe have much in common when it comes to digital health. I mean, we're using the same standards, we are developing the same way. And maybe India will go faster than Europe because we have this complex organization, and we stay different. So from that point, I'm a pediatrician. I work in primary care. Pediatricians in Netherlands follow the same guidelines as most pediatricians in the whole world, because the WHO just published very nice and good booklet on primary care preventive medicine for children. And that brings us immediately to perfect health. So it would be ideal if this booklet could be transformed in digital tool to support and in Europe, it's even in Europe, they have computers. So and patient, I'm also patient representative, so we also want the doctors to use evidence-based science, not AI. So
thank you so much.
There are already many evidence-based items, especially with WHO. When we walk through this room here, we see many posters, and it's at this moment still the babies in rural areas are orphaned by when they're born, because the mother dies of bleeding. I think these are illustrated in the pictures, and it's even probably easy if we can exchange and reach rural areas with this.
Fantastic. Thank you so much, Lisbeth. Sophie, maybe you would like to add something as someone residing in Lebanon and also thinking, if maybe you have to come to the mic. And then obviously co-chairs will do the closing of it.
Sorry, I don't have much, but now I will participate in part of the knowledge factory, because we are in the preparation of I'm happy to be here. I will participate in this.
Thank you. But what about your perspectives from Lebanon and from what these comments about just said about Lisbeth just shared from the field? What are your impressions and the relation with health tech governance on top of that?
Well, so I don't know if you from user perspective, we have a hackathon that we will organize on Friday and Saturday with the European Council meeting, and one of the challenge is also about AI, and we really endorse this topic is that of AI issues. And for example, we want to develop AI tools for the activity, which like we take global challenge And this is absolutely what we will do, and we will, data first, how we collect it. I'm happy with the discussion.
And thank you so much, Sophie, to put you on the spot. Oh, maybe we have here an intervention also from Lynn and Reese, from our event partners, the digital health arm of HLR, right?
I just wanted
Lynn, welcome.
Thank you. Sorry, I arrived late, so Raj, I missed earlier contribution from you. But first of all, I am fascinated by the data first, AI later approach. Sitting on the board, the commercial board of one of the UK's leading academic health science centres. Very interesting that when I first started asking the clinicians questions about the quality of the hospital's data, there was a universal reply that, with one or two exceptions, the quality was lacking, that it had some defects in it, okay, missing fields, reliability of the data. So anything that focuses on the quality of the data on the basis of somebody else saying rubbish in, rubbish out, that's clearly really important. I think picking up Steve's point about Europe not forcing regulation on other countries. For me, with the European health data space, what we all need to realize is that actually the law is one thing, its implementation is going to be more important. So in the next couple of years, the implementation powers of the European Commission and the individual member states are going to be where the action's at, if you like, in terms of this debate. So I think those of us who have an interest in health data and AI need to make sure that we are particularly active in this implementation phase to try and influence the best implementing actions that are possible. And then also picking up, I think it was probably George who talked about risk, and Stephen as well about driving. And I think the risk management and the transparency around saying, you know, AI is going to fail in certain areas, and there's nothing wrong with that, provided it's being done in a controlled way where we then learn. So I think this transparency and honesty about the opportunities that AI has in health, but also in that risk management, I would distinguish between the use cases. So whenever we're talking about clinical use cases, the evidence base is going to be very, very important. But if instead we were talking about AI being used by Google around searches that are made on Google. So we've been at this event, and I was staggered to hear that every single day there are 200,000 searches, unique searches on Google for health. So what Google has is an understanding of the top 100 searches that matter for people around the world. That data is really helpful for anybody who's involved in healthcare delivery. So I think we don't need to be so worried about that use case and how that data is used. So I think intelligent distinguishing between the use cases for AI and the evidence that's required for those use cases is going to be very important. Thank you.
Thank you so much. And this has been an incredible conversation in this opening session. I feel so fortunate to have all your participation and inputs here. So maybe we'll do a final round of comments by our co-chairs on the closure, and we'll wrap up for the Knowledge Cafe that's starting after this session.
Okay, well, I don't know much to add. I think it's all been said very eloquently. I think there's a common concern around the importance of data and data quality. In fact, I'm delighted that the word quality came out, because yeah, the assumption all the time is that the data that we're using is of good quality. And for those of us, at least in WHO, we know that's not the case. In fact, it's one of the big shocks for me when I joined WHO. I'd come more from an economic background. So the two things that struck me, one was the paucity of data in the health sector, and secondly was the quality. The other issue I think as well is the point that AI is the current fad, so everybody's jumped on it. And we've left a lot of basic stuff unfinished and undone. In fact, I have this constant argument with my colleagues at Digital House. You know, until every country has access to electricity, stable electricity, then why on earth would you digitize your records? Because then you don't have access to them. So, you know, like, as I said, there's a sequence that needs to happen. And if we keep jumping ahead without finishing the basic fundamentals, then increasingly we're just building houses on sand. And you know, we need to really kind of take that seriously.
Thank you. Final comments.
Yep. From my side, data is not the oil, data is water. Make it clean, hygienic, and portable. Make it available to everyone. Thank you.
Thank you. Thank you so much. Thank you, everybody. So we are closing the session now. Dear viewers, thank you so much for staying with us, and also our LinkedIn participants. It's our more than 6,000 reach. Will definitely be able to watch this video, as a few participants are watching live now. Thank you for that. Thank you, everybody in the room, for being here punctually at 9 and for the conversations and inputs you've shared. Thank you, Zoom participants, for being here. Thank you so much. So sorry you are not here with us in person, but
Next
I
time
hope
soon.
that you can get better soon.
Thank you.
Thank you all. And closing now the live session. George, it was great to have you here. Thank you so much.
Thank you, Paul.
Thank you.